What STDs do you need to get tested for? Patients ask me all the time for a full STD screening, but it's a little bit more complicated than that. Risk for STDs varies from patient to patient based on what type of sexual activities they engage in. The most common infections that we check for during an STD screening include chlamydia, gonorrhea, syphilis, and HIV. Chlamydia and gonorrhea are screened using site-specific tests. This would include a throat swab, a urine sample, and a rectal swab if the patient has had receptive anal sex. Testing for HIV and syphilis requires a blood draw. Sexually active patients who have a vagina should also be screened for trichomonas. This can be done using a vaginal swab. A lot of patients ask about testing for genital herpes. Testing for herpes is complicated because if you don't have an active lesion, like a blister or something like that we can swab, then we really can't directly test for it. An indirect test to check for signs of herpes exposure would be a blood test that checks for antibodies to the herpes simplex virus. However, this test is not routinely ordered because the results may confuse patients into thinking that they will have active herpes outbreaks when that's not necessarily the case. Another STD that patients ask about is HPV, which causes genital warts. Currently, the only available screening tests for HPV are pap smears, which are swabs of the cervical or anal mucosa. So next time you go to your healthcare provider and ask for STD testing, make sure that they're aware of your sexual history and what type of activities you engage in so that they know which tests specifically are right for you.